So we are basically going to go through a scenario, a couple of case scenarios that is going to give you an opportunity to apply some of the concepts that you've learned in 7410 in relation to this type of case. Like you were saying, what type of agent it was. So depending on the caliber of the bullet, certain like shotguns will spray bullets, so the injuries might be more extensive as opposed to, we talked about distracting injuries in the pregnancy case, and pregnancy itself can be distracting, and obviously a person with a gunshot wound, that's going to be a fairly distracting injury. So we want to know, do they have any other injuries as well? And so that's really what our primary assessment is going to help us determine. Okay, and so just to give you guys a really clear picture, gunshot wounds are what type of injury? Are they penetrating or blunt? Perfect, yes. Not difficult here, not rocket science. Okay, yes, so gunshot wounds are definitely penetrating injuries. But like we said, patients can have multiple injuries, so we can't at this point rule out that this patient doesn't have other blunt injuries from something else. Got this patient out of the ambulance bay, stuck him on a stretcher and kind of wheeled him into the resuscitation room. So we're going to go through a primary assessment. I'm going to kind of tell you guys, now I'm not going to get you to talk about everything that you're going to assess necessarily in each one of these sections. You guys are humorous. So his upper arm has a compound fracture and it's bleeding quite extensively. So what do we need to do for that?
Tourniquet.
What are we going to do? So yeah, perfect. So Lydia is saying that we might need to compress or control the bleeding in the chest. So that's kind of your first initial. We don't really know exactly what's happening here, but we know that there's quite a lot of blood. So we need to somehow just tamp down on that with either tourniquets on limbs or using compression on other areas. Perfect. So in A, we notice that he's moaning, he's groaning quite a bit, but he seems to have some decreasing LOC. Is there anything else that we want to kind of know? Yeah, so we need to have suction ready for sure, measuring our oral airways. We're definitely concerned that he's deteriorating. Yeah, so Armand is saying intubate early, right? Yes, and C-spine. Perfect. Great. Look in the mouth. Awesome. You guys are amazing. Yes, so we need to make sure we look in the mouth. Is there any loose teeth, bleeding, any thing that could be obstructing his airway? So if we think about, say, respiratory, what are some respiratory issues, hypotheses? Perfect. Yeah, pneumo, hemo. What else? You guys actually mentioned something earlier on. Somebody mentioned another potential injury having to do with respiratory. Yes, ribs. Yeah. So this patient could have some fractured ribs. They could have a flail chest. They could probably have a pneumo or a hemo, which could turn into a tension pneumo. Cardiac. So what are some cardiac problems that this person could have? Yeah, definitely tamponade. Yes, they could definitely have arrhythmias, hypovolemia. Yeah. Anything else that could have been, yes, exactly, dissection. Perfect. Yeah, so there's a lot of large vessels in there, and it doesn't necessarily even have to be the aorta, but it could be, the splenic artery, portal vein. All of these things have large amounts of blood in them, and so if bullets are going through certain organs and certain vessels, patients can bleed very quickly.